A mysterious illness in the Democratic Republic of Congo, DRC, has already sickened over 1,300 people and led to more than 50 deaths, and the numbers are rising at an alarming rate. Experts are struggling to pinpoint the cause, with possibilities ranging from chemical poisoning to infectious diseases like meningitis or malaria. The situation is spiraling, with cases nearly doubling in just a week, and the lack of clear diagnostic patterns is raising major concerns about containment and response. The symptoms reported: fever, headaches, body aches, vomiting, diarrhea, and even bleeding from the nose are disturbingly broad and could point to multiple potential causes. Infectious diseases such as Ebola, bacterial meningitis, or severe malaria remain on the table, but authorities have also raised suspicions about environmental poisoning, possibly from contaminated water sources. The World Health Organization, WHO, has expressed a strong concern that some cases may be linked to toxic exposure, yet no conclusive evidence has emerged. Without clarity on the source, efforts to contain the outbreak are hindered, and delays in response can mean more lives lost. One of the most worrisome aspects of this crisis is the possibility of undetected transmission. If this illness is infectious, it could spread beyond the affected region, triggering a larger outbreak with devastating consequences. If bacterial meningitis is involved, rapid transmission could take place through coughing or contact with infected saliva, and without swift intervention, such as mass antibiotic distribution and vaccination efforts, deaths could escalate quickly. If malaria is the culprit, mosquito control measures will be needed immediately, but even that presents challenges in a country where malaria is already widespread, with up to 78% of tested samples showing malaria infection. Experts warn that this might not be the full explanation. Patients could be sick with malaria, but also suffering from an unknown co-infection or environmental exposure. Even more troubling is the possibility that the outbreak is driven by a combination of factors. In late 2024, another unexplained outbreak in the DRC was ultimately traced to malaria exacerbated by malnutrition and respiratory infections. If a similar pattern is at play here, it means that already vulnerable populations, those suffering from food insecurity, poor sanitation, and limited access to health care, are at even greater risk of death. The weak healthcare infrastructure in the affected area is a major obstacle, with limited diagnostic tools and treatment supplies, making it nearly impossible to provide rapid care. If the illness continues to spread unchecked, the death toll could rise exponentially before authorities even understand what they are dealing with. The response to this crisis must be aggressive, immediate, and multifaceted. If toxic contamination is at play, finding the source and preventing further exposure is crucial. If a bacterial or viral outbreak is unfolding, swift public health measures, including quarantine, targeted antibiotic distribution, and vaccination, will be essential. And if malaria is the primary cause, mass treatment and mosquito control efforts must be deployed before more lives are lost. However, the slow pace of testing and response suggests that authorities may already be falling behind, leaving room for the outbreak to expand in ways that could prove catastrophic. The reality is that this outbreak, whether caused by infection, poisoning, or a deadly combination of both, is a ticking time bomb. With each passing day of uncertainty, more people fall ill and more lives are put at risk. Without urgent intervention, the DRC could face a full-scale public health disaster, with repercussions far beyond its borders. The international community must take this crisis seriously before it spirals into something far more deadly and uncontainable.